Southwest Florida. Welcome back to Lead Pitch Live. We've just finished the clergy symposium on the coronavirus vaccine, the what, when, the where, and the how. It was one of the most educational symposiums I've had the pleasure of moderating. Big thank you to Mount Hermon Ministries and all the other clergy people who've come out, as well as some of the healthcare experts. This is the post conversation, and we'll get a chance to talk to some healthcare providers just before they get out of here with their white jackets on, because these people love to get gone. Hey, so without further ado, we have Diane Spears here, who's a pillar in the community, and we have Dr. Sutton here, who's a family physician now and working out in the Florida Gulf Coast University area. We'll find out about that shortly. Before we get started, Diane, did you already know Dr. Sutton before today?
Yes. In fact, she helped us with the health fair at the Dunbar last year, 2 years ago.
Okay, so at that time you were like an intern or something?
I was. So it was actually my first year in residency. Right now, currently, I'm completing my family medicine residency at FSU's program over with Lee Health at Lee Memorial, right here off of Cleveland Avenue. So that's where our office is located. And when I met Diane, she actually presented an opportunity for me to be involved with the healthcare screening at Dunbar High School. And I jumped at that opportunity to kind of get immersed in the community because I'm not from here. And so kind of working with her to kind of make sure that we screen some of the male patients for prostate cancer is what we were doing.
Right. Diane, when you see people like her moving around in the community, you quickly embrace them and you quickly know that they can be a big benefit to what we're trying to do, especially as it relates to people of color.
Absolutely. Not only that, she shares a heart. When I went to them and spoke about both of the event that happened in Dunbar and at the church, they embraced it so fast. I just got with them, was it yesterday, to do this.
Okay, really?
Yes.
Okay.
That's how much they care.
And your connection with Diane Spears, has it all been rosy and just one of the greatest things that ever happened to you since the history of civilization?
Diane is amazing. She's been amazing with kind of getting us connected with some of the community resources. Like I said, I'm not from Fort Myers. And so kind of just being aware of what resources we have available within the community so that we can be involved and kind of be a face of the healthcare system and the medical system for those people of color and the minority communities, to know that there is some people out there that represent you, that look like you, that practice medicine, and that want to take care of you and make sure that you're well informed.
Well, it was extremely powerful to have you and Diane on that panel and to be able to bring that medical information forward to talk about some of those myths was just riveting for us. And we're so glad that we're blessed that we have both of you in the community who are sort of keeping an eye out and also educating us along the way. Let me get a few questions in on television that we talked about on the panel discussion, but we have another audience for television. One is, let's go through some of the myths. Let's start over here with you, Dr. Sutton. Are there any side effects if one get vaccinated for the COVID virus? And are these side effects pretty much the same thing as you would get from any other medicine? You know, that's always side effects.
Yes, so there are some side effects, some known side effects. The most common side effects are going to be those that are very similar to those that you get with the flu vaccine, and that's just a sign that your immune system is working. So you may get fever, chills, muscle aches, headaches, injection site soreness, maybe even some swollen lymph nodes. Once again, those are signs that the vaccine itself is working and that your immune system is fighting against that foreign invader, which is the vaccine.
Why should we, Diane Spears, why should we, particularly Black people, trust the vaccine?
Why should we trust the vaccine? First of all, we're higher at risk for getting COVID-19. And not only that, I'm not going to say getting COVID-19, but our mobility, our illness that we have already, existing illness, put it at a higher risk for getting COVID-19. So for me, to trust the vaccine is it helps build up my own immunity, my own antibody, so that I can fight COVID-19 versus me getting COVID-19 and possibly suffering severe illness and possible death. So I would rather trust the vaccine versus taking the risk of getting COVID-19.
I don't trust those white folk. They're going to try to kill all of us black people. We don't know what's in that vaccine. It's just they just trying to get us and just roll us in like the Tuskegee experiment. Blah 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 blah. What's your comments?
My comments is that we come a long way, and as Doctor said earlier, history is history, but we have come a long way, and we have key people in high places, people who are involved in making the vaccine, people involved in seeing that that it's distributed properly, people involved people like us. Mm-hmm. Who are looking out for our safety.
Totally different from Tuskegee.
Totally different from that. Mm-hmm. And they're looking out for us. And as they're putting this together, they're putting it together with our people in mind as well.
Right. People been this vaccine just popped up out of nowhere. Dr. Sutton, I'm just being David's advocate. This vaccine just popped up out of nowhere. No way they can create a vaccine that fast. How did they do that? Why should I trust it? Go.
All right. So, the FDA has given us emergency authorization use to be able to give the vaccine. And there has been trials that has been tested. It's important to note that this type of vaccine is a new type of vaccine. This mRNA type of vaccine is new. However, it is not that new. And we have already been studying mRNA vaccines from back in 2002 with the SARS outbreak. And so we were able to kind of take that information and take the knowledge that we had from the vaccine that we were looking into with that particular outbreak and use the COVID-19 virus or the SARS-CoV-2 virus, which is the virus that causes COVID-19, and try to manufacture a vaccine that will be just as safe and just as effective towards decreasing the risk of getting sick from the virus.
What is being done transportation wise? A lot of people don't have the transportation to go to hospitals or to go to clinics to get that vaccination. I understand. I heard that Lee Tran here in Lee County is partnering with everybody else in the health department to actually get people to where they need to be. Transportation is not an issue. Go.
As part of my Herman, and I'm on the outside of what they're working on, and I did hear that part of helping our community get the vaccination, that transportation will be provided. And that's about the most I can say about that at this time. Mm-hmm. And that, let me say this, and also I heard them say that not only transportation going to be provided, but if we give that first vaccine, they're going to get the second as well.
Mm-hmm. The whole idea of the fact that we heard in the symposium recently, the Reverend Dr. William Glover of Mount Hermon Ministries say that they've already gotten 500 people from various churches who are ready, who are 65 and older, who are ready to get that vaccination. What does that do in terms of the target focus in the minority community to prove a point that we have people who are ready to go and not wasting any vaccination by setting up a triage type concept here at Mount Hermon Ministry? So I think I used that word triage correctly.
You did.
Triage. I heard that on TV.
It's a triage.
Woo! The demand is here. The demand is here.
Right.
And it's a supply and demand thing. So now we have the demand, and
Right.
now we just have to meet the supply. So we need to have more vaccines produced and distributed within those communities so that they can be accessible to the people. And so having the people there is one thing. Now we need to have the inventory for the vaccines so that we can get them out there to the people.
And I like something that Dr. Gulliver said tonight, is that it's destroying the myth that African Americans do not want to take the vaccine. What I heard, that if you put it and make the access easy, available for me, that we will come, we will get it. That's destroying some of that.
Mm-hmm. The African Americans, people of color, are disproportionately being impacted by the COVID virus. Why?
Well,
go ahead. Take
one
that
at a time.
Take that one.
Go.
Let her take it.
So African Americans, unfortunately, I think that's a multifactorial question, and I don't have enough time to answer it. But minorities are more likely or are at increased risk of having more comorbid conditions, and that's high blood pressure, diabetes, heart disease,
Overweight,
being obesity, and a large part of that is cultural. How we were raised, how we eat. We love to eat. We love soul food. But that stuff isn't good for us, and so it does have an effect on our body. body, and it does increase our risk of developing some of these chronic conditions. And, some of the myths of like exercise, I never grew up with my parents exercising,
Nope.
and so that's something
Never
that's
saw
foreign
mine
to me.
exercise.
But we should be exercising at least
Mhm.
5 days a week. And so just kind of knowing that culturally there's some things that were instilled in us growing up that we didn't know. We just didn't know. And when you know better, you do better. And so now that we know better and we have the information and we know we need to eat healthy and we know we need to exercise, we can start to decrease those risks. But we are at increased risk for having comorbid conditions, which makes us susceptible to be infected and have more serious complications from the virus.
And in general, Diane, we don't just get our physicals every year. A lot of it is due to economic statuses and a whole lot of other things related to insurance and so on and so forth. But in general, low-income people, many people of color, they don't get those physicals every year. Like I go get my physical every year. I'm just, that also contributes to those comorbidities.
Yes. Because like she said, if you don't know, you don't do. But when you know better, you do better. And I want to say, over the years that I have been in this community and I watch, African American not getting health care. But I have to say, I see an improvement in that. I do see an improvement. I see them talking to us, talking about our health and talking about what we need to do. I see them having more information about their illness and how to take their medication. So there's a great deal of improvement. We're not as backwood as we were before. We're doing much, much better. We can improve, but we're doing much better.
What should people do right now? Certainly if they got relatives in their family who may not be computer savvy and all these other things, just the whole process, what should they be doing right now to start getting themselves in position to get the vaccine?
Again, get the knowledge, get the facts, know where the vaccines are being given. Don't be ashamed to ask a relative or friend to help you with the computer, to help you get signed up. Don't be afraid to do that. Because we're all in this together and we got to help each other.
Speaking of everybody in this together, Dr. Sutton, I'm thinking that if and the way this needs to work is a lot of people have to get that vaccine or it's all for naught in terms of so many people walking around without the vaccine. We can never get back to what we consider normal, right?
Right. So the goal is for enough people to get vaccinated so that we can reach this thing called herd immunity. And so we need to have enough of the population vaccinated and able to combat the virus and create antibodies against the virus so that we can reach as a population herd immunity so that it is not a concern. It would be treated more like how we treat the flu. And so that's the goal. And that's why we're trying to push the vaccine, not just, to the minority population, but to everyone. But because we have seen that the minority population is not getting vaccinated at a higher rate than some of the other populations, we want to target that population more readily so that they have the information available to them.
I have underlying conditions or several underlying comorbidities.
We with you.
Can I get vaccinated?
So I think that with that, having those comorbid conditions, you are at increased risk of having a more severe complication of the virus, and that makes you a candidate in meeting the criteria to be vaccinated. As far as we know, the research shows that the virus itself or the vaccine itself works for our body to mount an immune response and produce antibodies. Those antibodies should not impact your comorbid conditions, your chronic conditions. We want you to get the vaccine so that you decrease your risk of getting sick and worse, dying.
We hear that there are 2 vaccines on the market right now in the simplest way possible. What's the primary difference in the two, and should we trust both of them?
They're both made from, and correct me if I'm wrong, doctor, they're both made with mRNA. So
what does that mean?
It's a messenger RNA that they're made from.
Okay.
Doctor probably can explain it better than I can.
They come from the same.
Right. So
right.
It's not that much different.
They come from the same family.
Same family. It's not that much different. Only one you have to take. You take both of them twice, and one 21 days, and the second one 28 days.
And that's only because of how the trials were made. And so the trials were made, and the evidence that they have is that the the Pfizer
Pfizer.
vaccine, you take 21 days afterwards, and the Moderna, you
Moderna.
take 28 days afterwards.
Mhm.
They both are in mRNA vaccines, which allows your body to be able to get a small piece of the genetic material that makes up the proteins that are infectious on the virus. And so that vaccine allows your body to create those proteins and mount an immune response so that you can be protected against it. There are other vaccines that are currently being created, and those are different. They work differently, but for right now, we have those two that are available, and those are very similar. And the effectiveness, that's what we know. They both are greater than 90% effective, 94 and 95.
95%.
Yep. So they both have been shown to be 95% effective after getting the second dose.
Okay, from looking at both of you, it appears that both of you are African American. Both of you are healthcare providers. So we assume that you've already had your vaccinations because healthcare providers got their vaccinations. What was your experience with the vaccination, and did it take to you very well?
I did very well. The first dose, I was very fatigued. I took it on a Thursday. On a Saturday, I could barely get out of bed. I was just tired, and I slept all day. The next day, I felt wonderful. Second dose, no problem whatsoever.
Did you have any apprehension about taking it at first?
Oh yes.
Okay.
Oh yes. Oh yes. Honestly, people wouldn't believe it. As being a healthcare worker, and my first thought was, I am not going to take that vaccine.
Really?
I'm not going to take the vaccine. I want enough people to take it, and this is what I want enough people. Okay, go girl.
You being honest.
Okay,
You being honest, Miss Diane.
I want enough people to take it to make sure it's okay to take it. But after I got the education and the knowledge as to I was not getting a live vaccine, I was getting something that's going to make my body fight for me, and it was safe. It was not introducing anything that was going to be harmful to me. It's making protein. I need protein. My protein triggering my antibiotics to work. That was good for me.
Okay,
That was
so
good.
she said something about having her body fight for her. When you start having some of those effects that she mentioned, that's your body adjusting and fighting back. Those little
our little soldiers.
In
They
there.
in there fighting. They
So
in there
the
fighting. Our immune
antiviruses,
system.
I think it is.
It's our immune
Immune
system.
system, and
Yeah,
they're
so we have
fighting it.
many different immune cells, and they work. That's their job, to work to help our body fight off foreign invaders. And so the vaccine uses our own immune system in order to mount an immune response so that we can fight off the COVID, the coronavirus, if we are in fact exposed to it.
Did you have any apprehensions about taking the virus?
I did. I definitely had some apprehensions about taking the vaccine, and I think largely that was because I too thought, oh, it's being created quickly. How do they know, that it's going to be safe? Is it going to be effective? But once I got the information and knowing a little bit of the history, that this was not something that was new and just thought up, but that we had some material, we had some information to work off of, and now we have a new virus that we can use to kind of generate a vaccine that may be effective for combating this virus.
Okay, and I had some apprehension as well. I haven't taken it yet. I will take it when it's available. My main thing that made me comfortable knowing that I would take it is that once I saw a whole lot of white people taking it, I'm just going to tell it like it really is, as Malcolm X would say. When I saw all the millions of white people taking this medicine, I'm cool. Okay, so I know it's not something to try to do something to the black population. Okay, the fact that people did have some apprehension, that's fine based on what they're saying, but now it's time to keep on moving forward. And final question, final comments. What would you like to say to Mount Hermon Ministries here in the heart of the community on the positive corner on Martin Luther King Boulevard for being at the forefront of helping to make this church a location that vaccinations will be taking place in probably in about 2 weeks?
I can't thank Mount Hermon enough for being a church that really cares about the community. I see us go not just with our parishioners. They reach out and way out and go beyond what's expected to provide for this community. So I can't thank them enough. Pastor had to twist my arm and said, Diane, you need to do this. And you know what? I am so proud that I listened to my pastor.
Okay.
This is one of the greatest things that I've done because it's saving life.
And I think that the fact that Mount Hermon at least in the last 10 to 15 years, has just kind of like been sort of health oriented anyway. So this made it an easy process to ramp up and embrace what we're trying to get done. So that's really good. Big shout out to Mount Hermon, Pastor Glover, First Lady Glover, and the whole congregation. Let's go over to you. I think this may be your first time. You've been in Mount Hermon ministry before?
I have not.
Right. So what was this whole,
right,
I want to get your perspective on what was this whole experience like being a part of this panel discussion and seeing everybody coming together on one accord for the betterment of our community.
I think it's a beautiful thing. I think it needs to happen more within the community, because we have to continue to try to meet people where they are. And people are, within their church home. They go there, well, at least before the pandemic, every Sunday. They listen to their pastors. And so kind of coming together with faith and with science, and making sure that we are able to communicate and come together to make sure that people are informed and that people have the information so that they can make a well-informed decision about their health. I think it's very important. I'm so happy to be involved, and I look forward to maybe being involved in other events.
There will be others. Okay. You on the map now.
Sure.
People are seeing you for the first time. We kind of have a little tribe around here where everybody see me and Diane and Pastor Glover. They seeing you for the first time. Tell them where and how they can continue to interface with you and what you do over at FGCU.
So right now, currently, like I said, I'm doing my family medicine residency. We work within Lee Memorial Hospital off of Cleveland Avenue in Suite 709. That's the FSU GME residency clinic. And I'm completing residency training with a whole bunch of my colleagues. And a big focus of our program is making sure that we reach the underserved population, that we are training culturally competent physicians in order to provide medical care to all, and make sure that we give individualized medical care. And so I think that being here and being a representation of the medical community, to show that, we have folks that look like us. We have not only people that don't look like us, but people that care about us. That's very important. And so we're available there. Hopefully you guys can get my contact information. We're accepting new patients.
Go ahead. Just give a phone number.
213-343-239. Sorry, not from here. 561 is where I'm from. 239-343-3831 is our office contact information, or you can kind of just look on Lee Health's website and look up FSU's GME, that's Graduate Medical Education Clinic, to get more information.
Just for my understanding, I'm hearing you say FSU and I'm hearing you say Lee Health. So this is a partnership between the university and Lee Health?
It is. So Lee Health has created a partnership with FSU, which is Florida State University, Florida State College of Medicine. I actually graduated from Florida State.
So when I go through a Immokalee, I see something that says FSU medical something, right?
Yes. So FSU is the medical school itself has created an initiative to try to increase primary care physicians within the state of Florida. And we have multiple different campuses throughout the state of Florida where we're trained as medical students to go out and work within the community. So I actually worked at the Fort Pierce campus as a 3rd and 4th year medical student. And we have the Immokalee campus, where we reached a lot of the migrant people out there. A lot of the high school students work there through the U-Stride program to kind of do education initiatives and things like that. So we have people throughout the whole state of Florida. And now we have a partnership here with FSU for the family medicine program. And hopefully we're creating another partnership with Lee Health for internal medicine residency coming up soon. So FSU is doing a lot of big things with Lee Health, and we hope to continue to kind of build those partnerships.
Diane, final question. She said something about the whole that they are focused on underserved community. The whole idea in the medical profession industry, this is commonplace now, that this has always been around, where there's a propensity to laser focus on the underserved community and training people in that particular regard? Or is this a kind of a new thing coming along now?
We've always been focusing on the underserved, but not as focused as they are.
Okay.
It's always been our mission to serve the entire community, but actually making that happen has been a little bit problematic. Having the school there and openly saying we accept the underserved has made it much improved.
Okay. And you, as a both of you in the healthcare field, but you're going to become a doctor. You are a real doctor. I keep getting that confused, but you're saying you're in training, but you got your doctorate or whatever.
licensed physician.
Black doctors in general, black physicians, it's pretty much you guys have that two-pronged approach to medicine, based on your skin culture, your culture, and everything else. You have just throughout the process of becoming a physician, as well as you, Diane, you guys have like that two-pronged approach where you're constantly keeping your eye on people of color, right?
Mm-hmm. Yeah, I would definitely say so. I care for all my patients the same.
Right.
I think, it's just important to recognize the differences in patients. And that's what I mean when I talk about culturally competent medical care. So, I would not treat, a Caucasian person with low risk factors the same as I would, an African American that has multiple comorbid conditions, because I need to be more keen to some of the things that they may be at risk for. And so that's just a part of being a good healthcare provider, is being able to tailor your medical care for your particular patient. You look at your patient that's in front of you, you look at their risk factors, and you determine what's going to be best for them and their health.
Let me just say what makes it, having African American healthcare workers, physicians and nurses and other ones, is that we understand how to communicate with each other. Sometimes when the physicians are talking to the patient, they don't understand, and they're embarrassed to say, I don't understand. Well, we know some of that stuff right up front. When I'm talking to my patient, and I'm talking to an African-American patient, not that I think they're dumb or anything like that, I know that I got to not bring it down, I'm not going to say that, but I got to talk in the language that they speak. There are some medical terms I'm not even going to think about using. I'm just going to break it down to them, just like this is how we talk. They receive it, they trust us.
When I have a doctor tells me, either one of you, advanced registered nurse or what have we, and they take my blood pressure and they say, your blood pressure is kind of high, but it's okay for African American. It's okay. What are they saying to me? Is there genetically we kind of carry around or generally a higher, like 10 points higher or something like that?
Let me just tell you from doing health screening and health fairs, then I'm gonna let her answer from a medical standpoint. Whenever I'm in the community and I'm doing health fairs, and I'm doing it in the African American area, I know already that their blood pressure sometimes is a little higher than what we expect. So my thing is, if they're running below, and I know this is not standard, if they're running below 90, it's in the 80s. It may be a little greater than 84.
That's that bottom number.
That bottom number. I'm going to say to the nurses, just make sure they're on medication, and you don't need to send them over to the doctor if they already have a doctor and on medication, because their blood pressure, I know, is going to be running a little higher.
Okay.
So not that I think that that's what it should be, but I understand already, so I don't get panicky and go, oh my God, I got to get them over to somebody, because I know that already. But I do teach and talk.
So I think that high blood pressure is high blood pressure. Okay. And I think that we, have to recognize it and make sure that we try to treat it appropriately. Now, Black people have higher risk factors for having these conditions, but the numbers that make high blood pressure are going to be the same for all people. Now, what medications you are on is going to be different. Maybe if you're Caucasian versus African American, because research shows, and we do different research to see, well, this medication is more effective for African American people. And so we might choose a certain high blood pressure medication for Black people because we've shown that they have better outcomes on that medication. But we want your blood pressure at 120/80. Anything above that is creeping up to high blood pressure readings, and we want to try to keep you in those normal ranges.
Woof. Okay, I'll keep working for 120/80. Lord have mercy.
And we do that with diet. We do that with exercise. And if we have to put you on medication, we will, but the most thing is making sure that we do our part. And I think everyone has to do our part to be well educated and to make sure that we, eat healthy and that we make healthy decisions for our health.
Right. Now, if I was in a doctor's office, that'd be a different thing. But when I'm at a health fair and I'm seeing hundreds of people, there are some things
For sure.
Right. Okay, so everybody is everything. Everything's cool. We got that inside scoop. And the bottom line is know your
numbers.
know your numbers, right?
Okay.
Right. I think know your status.
Yes.
Right. That's the word.
Yes,
What
know
your
your
status-
status.
well,
Go
I
to
would say-
your doctors. You know, go to
Exactly.
your annual screenings. You know,
Right.
your doctors are not just available for annual screenings. I mean, if you need help with things, if you want to get help to stop smoking, you want to get help to lose weight, you have to start utilizing your healthcare professionals for what
Exactly.
they're educated to do. And so I bring my patients back all the time to work on weight management, to work on diets. I tell them do a food diary, bring it back. Let's go through it together, because that's how we're going to make a difference and start to decrease some of these healthcare disparities that exist within the minority communities.
And what I want to say, we got to learn to ask the question. Do not be embarrassed if the doctor tells you that your blood work is not normal.
well,
Don't walk away with that. What are you talking about?
Mhm.
What is not normal
And
about
I run my
blood
doctor
work?
crazy.
So, but we.
I be asking a lot
I
of
know,
questions.
but we're
But I'm
we
a
are-
TV talk show host. You don't just tell me anything. But
Get all the information that you need to know. Ask the question. It's okay.
yeah, but I know my mom come from a different generation. She's still alive and all of that. But she's real quick not to challenge a doctor, ask any question, because she's kind of from that old generation where certainly when they have those white doctors, they don't feel, they just feel like, everything that's being said is just the gospel. I can't ask any question. Let me just take all these thousands of pills. And me, I'm like, hey, add some, let me call this doctor and see, that's just a cultural thing.
So yeah, I think a large part of it is a cultural thing, and I think that if you don't feel comfortable asking your healthcare provider things, then you need to find another healthcare provider. I work alongside some amazing physicians that are Black, white, Hispanic, and we definitely take care of our patients no matter what they look like or where they come from or what their income level is. And so if you don't feel comfortable asking those questions or you don't feel like it's your place, then you got to find a healthcare provider that you can talk to that is going to get down to your level and be able to look at you as a person and say, I know you like your fried chicken and macaroni and cheese. I know you like your Creole food, or your Jamaican food and your seasonings, but you got to slow up with the sodium and the salt. You got to code switch, and be able to give them what they need to get the information that they need so that they can make the right decisions.
You guys heard it right here. And no matter what the race is, whatever the education, but my doctor is, I'm going to be asking a lot of questions because I come from a different generation where I just look you right in the eyes and say, let's talk, okay? So anyway, ladies, it's been a pleasure having both of you here. And great job tonight in the panel discussion. And I'm sure we'll be seeing more of you in the future. And congratulations to Diane Spears, one of the Lepus Live 2020 Persons of the Year. We'll see you.